So y'all keep the questions coming. I know there was lots of stuff in there, and I still see some questions coming through. She's got that information, just reach out to Wendy. She's an awesome resource for our entire team, and I know that she can be one for everybody because she's such a giving heart too on that. So we're gonna have another panel. We got a panel coming up this time. And they're here to answer some questions for us. I mean, they've been in this for a little while. So I'm going to share my screen and
so this is a panel of medical professionals this is their perspective on the drops. So we're excited to get them here on this Zoom and get it from another medical view.
And of course, we don't make any medical claims here, obviously, but we have professionals that are giving their opinion, taking the time out to talk about all of these products and why they're beneficial to us all.
First,
I didn't mean to cut you off there, Allison. Continue.
Oh, no. Great. First, I'd like to introduce, this is our cousin, Shelia Bryan. She is an RN with her BSN degree, and she began her healthcare back in the 1980s. She has been an awesome part of our family, and she's always been our caregiver. She spent 15 years in the hospital care, and then followed by 24 years in home health, where she worked her tail off in home health. She really did, and it's very stressful on her. And then she's moved to she retired from that, and she started working in the elementary school as a school nurse. And I think that's where she had the most fun. And so now she's retired and she's doing this full time. So she's going to share a little bit, but I'm going to go ahead and introduce everyone, and then we'll come back and they can all speak. The next person is Sharon Hutchinson. She is also she's originally from Ripley, but she lives in South Tillow now, and she's been a friend of ours for forever. She is a vascular sonographer with 32 years of healthcare experience. She spent 25 years in hospitals and now works at North Mississippi, and I can't say that, Cardiothoracic and Vascular Surgery Clinic. She is passionate about healthy living, and she's always posting recipes and how to eat healthy. So I love following her on Facebook. And she has 2 beautiful children and grandchildren. And so I can't wait for you to hear about more from Sharon. And final but not least, our beautiful Brandy Wilson. She's from Tennessee. She is a registered nurse with 22 years of experience. She is a certified case manager and health coach. She worked in ICU, emergency rooms, and short and long-term care, and now proudly supports our military. So, okay, so girls, y'all are on.
Whoever wants to start us off, go right ahead.
Shelia, you go first.
Can you see us?
Hey, everybody. Hey, what a wonderful morning it's been. Such great information, and so good to hear from everybody and see some faces. I'd just like to say that I've recently had surgery and was pretty much no weight bearing for 8 weeks. So, the whole time I dreaded, because on these drops I had lost 30 pounds, and I'm thinking, oh no, I'm going to gain every bit of that back when I'm down on this. Well, I will tell y'all, when I could finally get on the scales, I only gained 5 pounds. I did the drops once a day, but I kept on the MOA. And y'all, I will say, of all of my products, if I had to do without, I would have to keep on with the MOA. And I think I was very skeptical, because of working in healthcare and medicine. I always been around to treat the disease. That's what I did. But I've learned so much, and it really stood out to me with my 3.5 years working with children. When I first started in the school system, the medications that I was given for the ADHD, I was probably given 6 a day. Before I left there in 3 years, I was up to giving 45 medications a day to children. And between me and Cheryl talking and all of her knowledge about the foods, I had a conversation with the principal and we were saying, what's the deal here? What's going on? Because, there's good parents out there, you can't just think. And, now I go back and I see it's what we're putting in our bodies. So what I've learned is we've got to start preventing disease instead of letting the disease happen and then treating it. And that is something that has taken me a long time, and I'm still learning every day with it. But now I find myself with the physical therapist now that I go to, we're talking about, oh, you need to try some MOA, or let me tell you about this, or hey, look at you need the Bobby Parrish app. So when you go to the store, the things you're putting in your body are better. And I'm hoping that the others around will see that.
Thank you for that, Sheila, so much. Sharon, you want to tell a little bit about you and what you got going?
Is she froze?
She might be frozen. Oh,
Yep.
we lost her.
We lost her.
Well,
Brandy?
she'll come back on.
Yeah.
Y'all kind of heard my story a little bit earlier. I had a very traumatic foot surgery and did not walk for 9 months. And because of that, I developed a nerve disorder. So that's where my journey began. I just wanted to feel better. And the drops was my first introduction to this. That's the one thing I remember. We didn't even talk about weight loss. Of course, that was the wonderful thing. I lost 45 pounds in a month. Still not being able to walk. And then I was introduced into MOA. And MOA for me was the saving grace, because when you're not walking and you're hurting and the pictures are just, those were tame compared to some of the pictures I have of my foot and my leg. But when you have something like CRPS and it's a nerve disorder, inflammation and pain rule your everyday life. And MOA keeps me from having to increase medication. It keeps me from a flare-up, which a flare-up for me means that I'm in a wheelchair or I'm in the hospital having to receive pain management because it's so bad. So when you look at it like that, the foods you put in your body, the superfoods as the MOA, it really changes your whole outlook on how you take care of yourself. And as a nurse, I have a lot of education, I've got a lot of experience, but that did not meet what was happening to me. So we had to look for something else, and MOA was my game changer.
Absolutely. Absolutely. Thank you for that too. Because we kind of watched a lot of that. Because
Yeah.
when you joined, we saw all that kind of happening too in real time. And it really was amazing. Sharon, do you want to tell us a little bit about you and your story here?
Sure. So it was mid-February of last year, and I was in Nashville at Danessa's house, who spoke earlier, and she had lost 30 pounds and was looking fabulous. And I had a daughter who just got engaged and was getting married, and I wanted to lose about 30 pounds. So I saw her taking the little drops before we would eat, and I said, so what are these drops? And she kind of told me what they were and that they were homeopathic. And I thought, well, that's good because, that I like something that's all natural. And she was like, I said, do they really work? And she's like, they really do. I wouldn't tell you if they didn't. I wouldn't tell you that they worked if they didn't. So I thought, well, let me try them. So I did. And they just changed my life. I had problems with my menopausal symptoms, hormonal problems with hot flashes. Like Allison had Hashimoto's, so my thyroid was out of whack on that part too. So they helped with my hot flashes, they helped my thyroid, and I lost 30 pounds in about 6 months. I lost 2 sizes in my clothes, about 30 inches. And for the first time in I don't know how many years, I slept all night, every night, which was such a blessing because I had not slept well in forever. And I also have recently, the past few months have added Renew, which that helps tremendously with the sleep also. So I highly suggest the Renew product as well. I have lots of energy. and reduce cravings and hunger. I had a lot of problems with my hair falling out, and it was real short up to here. So you can see now my hair's growing. It's not falling out anymore. And I just overall feel amazing. I've gotten off my thyroid medicine. I got off my hormone replacement therapy, which I was thrilled about because that, as we know, the hormone replacement prescriptions can increase your risk of cancer. So something that can naturally help you with your hot flashes and menopausal symptoms is just a big win in my eyes. So I was looking for myself, for improvements for myself, but what I found was that I was so excited about what I had experienced, I decided to share. And I decided to go ahead and sell because I thought, well, I'll get mine free. They're like, just try it. So I did. I posted on Facebook, and people were just, they just come to you. If you just share your story and how wonderful the drops have been for you, they will come to you. So I have been able to help others, which is such a blessing. I didn't go into it for that, and I did not think of that when I started, but being able to help others and getting so many texts about, how other people are having so many, positive outcomes from the drops, that's been a blessing. And in healthcare, it's kind of like Sheila said, you're used to treating people, but with the drops, I feel like this is a preventive method. So if we can get our diet with the approved plan, stick to the diet, and take the drops among the other products. And I, like others, I'm on the optimals, I'm on the renew, I'm on I don't know, the Venali, I'm on lots of the products too. And I feel like if you can prevent sickness, that's the best way to help yourself. God gave us our body, and we are to take care of it as his temple. And doing the drops has just been the best tool to help me get healthy and also to help others get healthy. So I'm so thankful for Partner Co. And I'm thankful for Jerry and Allison, Liz, Cheryl, Danessa, so many that helped me get back on track in my life and my health back on track. And now I enjoy helping other people get their lives healthy again.
So ladies, we do have a couple of questions. One question is, what are the top 3 products for MS or for people that have MS that you would recommend, and any additional add-ons?
I'll take that one because MS is closely related to CRPS. So the 3 products that I have included in my treatment plan with my doctor is my drops, because they help balance the hormones. Insulin is one of the biggest ones that I have to keep balanced to keep my pain and inflammation down. MOA, of course, because it is a superfood. It's not just another product. It's an actual food that I can put into my body and help my body work correctly, along with the drops. And then the optimals. The optimals, because of, like Kristen said, you don't just need the recommended daily, you might need more of something. So the optimals give me that more to keep my body where it needs to be to help control these symptoms. Because when you have a chronic condition, you can decrease it and live with it, but there's no getting rid of it. So my optimal goal is to go into remission. And these are what my doctor tells me. Hey, if you stay on this along with the food list, because they are natural, they are homeopathic, they're not going to take away a natural function of my body. They're just going to enhance my body to be able to use that function. Then we can look towards remission. Did that answer? Question?
Yes, yes, I do believe so. Yes, you gave the 3, so thank you so
Yeah.
much. Do you other ladies want to add anything to that?
One thing that I might suggest would be the probiotic, because you've got to have good gut health. And that may be, each individual is different, and they may need the Magna Cal D and the optimals, but the probiotics, your gut health is so important for your overall.
Sharon, would you like to add anything?
No, I agree with them. I think the probiotics, they all say that everything goes back to your gut health. So it really is a good one to add for sure.
Perfect.
The noni juice as well, but most people like the
Noni's good.
Nemo. The super fruits are awesome. Definitely would add one of those.
Well, thank you so much, guys. So the next question, although she told me not to ask it, people want to know y'all's opinion. Why the drops? You see all these you see a ton of diet fads, right? And medications, which I'm not even going to mention. But why the drops from your medical opinion?
I'll take that. Yeah, I had weight loss surgery probably 20 years ago. Lost about 50 pounds afterwards, but guess what? It came right back. With the drops, I've lost around 40 pounds. I've kept it off. And like I said, even with being non-weight bearing, pretty much chair bound for the last 3 months, only, not having activity much at all, only 5 pounds. And I think it's because the drops actually help our body get back into a normal state where it needs to be. It also, if we follow that food list, because there's so many disruptors in the foods that we eat, and those drops just help you to not have that appetite. And if you cut back on that sugar and you stay on those drops, you don't have that sugar craving like I used to have all the time. So I think it's the homeopathic getting our body back where it needs to be.
And it helps you all the way around. So it's physical, you have less pain, you have more energy, it's mental, you don't have the cravings, your cortisol level is low, so that means your stress hormone is down. So when one product treats your whole body, and your body's able to use it, and you're not putting anything synthetic in it that's going to take away a body's natural process, then you can help. You're not harming it. You're not causing your body to say, hey, I don't want to do that anymore because you've been giving me something that's been doing it for me. So that's the big thing. Especially, I keep going back to chronic conditions, because I think it's 95% of people now have a chronic condition. And that will help, and it won't interfere. It's going to help it because you're not putting anything else unnatural in your body.
Alrighty, perfect. Let's see. Let's go through some more questions here. There's a question. Are the drops safe to use for someone who wants to lose weight before getting pregnant?
The only person who cannot take them are pregnant and nursing moms. If you're trying to get pregnant, I would just talk to my doctor about that.
You other ladies want to chime in on that one?
Definitely take it to your doctor. Let them see what's in it. Take the clinical trials with it. That's what I love. I took the clinical trials to my doctor. And with anybody that's trying to get pregnant, a lot of times, I'm a high-risk pregnancy nurse with the military. Your hormones are out of balance. So if you are trying to look for something naturally to get those hormones back in balance, this could be the key to that. So definitely take it and get with your fertility doctor or whoever you're seeing, and take those clinical trials with you. Let me tell you, they're amazing. And they really eye-open this homeopathic drops.
And this might be the last question for the day. Could you confirm proper usage in terms of dosage amount and time frame before meals? I believe this question is about the drops. Could you confirm, as there is some mixed information out there? So, Billy, are you talking about the drops here? Because if so, I would follow the directions that come with the drops, and what those directions say are to take the drops 3 times per day, preferably before meals. But I'll let you ladies handle that because you guys are the medical professionals.
Is he saying, are you not supposed to eat or drink before or after the drops? Is that important?
I believe so. Yeah, I believe so.
Yeah, the homeo, the way that they're designed, homeopathic therapies get diluted if you're eating or just want to eat or drink before or after, because you will dilute the product. That's
Yeah, and I can add in two things on the last two subjects. One is just because I've had such a bird's eye view of this now for a really long time with lots of people. One of the things we see with the drops, I can't really explain it for you scientifically, but we see a tremendous amount of women whose cycles are off that normalize. We see women, Brittany being one of them, whose cycle was not occurring at all, that began to have them again. I've even had 50-ish-year-old women start their cycle back and complain about it, that they don't want to get pregnant at that age. And then I've got a lot of cases. I'll give you one in particular because I've shared this publicly before. There's a lot I know about, but I don't have their permission to share it. But Chelsea Parker, working with Kristen White, and I don't know if Kristen's still with us or not, but Chelsea had two back-to-back miscarriages. And after she joined us, she wanted a baby. And Kristen went through everything she was putting in her body. She identified some protein shakes that she'd been taking with another company that has some harmful ingredients in it. They eliminated that. They eliminated a couple other things. And she started on the drops. And she just had her, I mean, everybody follows her on Facebook knows that she just had a baby because of that. And so just great results there. And then as far as taking them, what we have found with the drops is that there's only a couple of things that greatly matter. I'll say this for all the analytical minds of the world: the directions are written for a reason. The closer you follow them, the better results you're going to get. But the biggest thing with the drops is to understand they're sublingually absorbed and they need to be in your blood system. So you cannot do them together, but when you do them or how you do them is really not that important. So it is really difficult for the average person to do these drops 3 times a day, one of them 10 minutes before you eat, the other one right when you eat. So if you can do that, wonderful. But if you can't, just separately get them into your mouth 3 times per day. It's a sublingual absorption, so do not have water while you're doing it or food while you're doing it. Leave them for at least 10 seconds. If you've got nothing better to do, longer the better, because once you swallow, very little absorption occurs. So separately, but if you need to eat right when you finish, wonderful, do it. If you want to drink some water after you do it, and you're dying of thirst, do it. But don't just do it to do it. It's like come as close to directions as you can, but those are not detrimental things as long as you don't do them together. You do have to do them separately. You can do it back to back, though. You don't have to wait that 10 minutes. So maybe that'll clarify that up a little bit. By the way, you ladies did an awesome job.
Thank you, Todd.
And yeah, appreciate y'all being here so much. We got to get going though on the next thing. Again, y'all, if y'all will put your questions in the chat, we will try to reach out to these two off the thing, and they're here for the meeting too. They can reply and just put them right there. And these girls are amazing. And we call them a lot. And like you said, especially with Shelia there being our family.